Welcome to Unscripted, the AMCP podcast, a look inside managed care pharmacy.
Imagine you start having vague, subtle symptoms. You don't know what's wrong exactly, but something just doesn't feel right. You see your doctor maybe multiple times, but nothing is helping and your symptoms just keep getting worse. It takes you months, maybe even years, to find out that a life-changing diagnosis has been the culprit all along. And then imagine that the reason this diagnosis took as long as it did is because of the way that you look. Welcome everyone to Unscripted, the AMCP podcast. My name is Steve Kheloussi. I'm a managed care pharmacist by training, and I'm the principal consultant with Kheloussi Consulting. In this episode, we'll be discussing multiple sclerosis and its impacts on patients and the evolving role of managed care in improving access to treatment and support. Today, my guests are Blair and Dallas Burleson. Blair is a patient with multiple sclerosis who's lived through this exact experience and has taken it upon herself to address disparities in diagnosis. Blair, Dallas, welcome. We're so excited to have you here.
Thank you. Thank you for having us.
Glad to be here. Yes.
Can you tell us a little bit about your diagnostic journey and how you ended up finding out that you had MS?
In 2017, that's when I first started receiving some prominent symptoms to let me know that something isn't quite right. Those symptoms continued. They looked like being nauseated, sick to my stomach. I had vertigo issues. I was just weak and I was extremely fatigued. It wasn't until February of 2018 that I had a huge symptom of the right side of my body going numb. So the next morning I went to go see the doctor and my doctor advised me, she said, everything looks fine, everything's checking out, but I want you to go to the hospital and get a CAT scan. So I did. And when I went to the hospital, my CAT scan came back fine. And they said, we're going to admit you though. And so I was a bit confused as to why am I getting admitted? And they said that we want to do an MRI on you. We want to do a brain scan and kind of get a closer look. I said, okay, no problem. That next day is when I had my MRI, and at 4:35 p.m., that's when I received a phone call from the doctor on duty. I'm sorry, but you have multiple sclerosis.
Wow, and how did you react in that moment and in the days, the weeks after?
In the moment, I was thinking, okay, give me a shot, fix it, let's go. But then I quickly learned it wasn't that easy. As I began to research and talk to other people, I found that, okay, this is going to be something I'm going to be living with for the rest of my life. The confusing part was the physician came and told me, he said, you have multiple sclerosis, but it's just not textbook. So that was even more confusing. What do you mean it's not textbook? It wasn't until years later that I found out what he meant. As we researched, okay, so this is what the textbook says. I met every single criteria of what the medical definition of multiple sclerosis describes, except for one. And that is that MS is prominently or only for white women. And I did not fit that criteria.
Oh, that's so interesting. And so that then delayed the diagnosis, or it contributed to maybe some confusion from at least your side in the way that the providers were approaching this.
Absolutely. It delayed my diagnosis for 7 months because no one was looking for it. And during that time period, it's continuing to progress. Continuing to progress. When I finally got diagnosed, I have over 20 lesions on my brain.
And so how did that then impact your next steps as you established your foundation?
Once I understood what it meant, I kind of felt a little bit like, how dare you? MS does look like me. And it hit me over and over again. MS looks like me. Not just me, but it looks like so many other people. It looks like men. It looks like a Hispanic man. It looks like so many others. MS looks like me. It's not a cookie cutter. It is not just for one person. And I knew that it needed to be out there, that MS looks like me. it doesn't necessarily look like the person in the wheelchair either. So we needed to have a clear understanding of there is a wide range of what this chronic illness can look like.
Yeah, such a admirable mission, right? Is just helping others avoid the feelings that you were feeling when you first received that diagnosis and were told that it was not textbook. So I've heard of MS being described as a snowflake disease. What does that mean exactly?
Snowflake disease generally means things and symptoms that are happening that are not always the same, and they're also not visible. Sometimes Blair and I will go out, we'll have dinner, and we have to cut our dates short just simply based off of her not being able to feel something. And so sometimes as a caregiver, I'm concerned when she drives out because, of course, if it's hard for us at times to make it through a dinner, she's smiling and everything is going good and we're twirling and dancing and all of a sudden she can't feel her legs or it's her arm.
Wow. So it sounds like from the payer perspective, we need to appreciate that no two patients are going to present the same. And then even your symptoms within the same patient, right, will be different from one day to the next and maybe from 1 minute to the next. Let's take a step back. So you founded this foundation, you established this foundation. What is the goal? What is the mission of the foundation MS Looks Like Me?
So MS Looks Like Me is a reliable source for resources for people with multiple sclerosis. And not just for people with multiple sclerosis, but we have resources available for all autoimmunes. We have resources that are available for the patients, for the caregivers, from financial resources to mental wellness resources to even exercises that they can do, no matter what their capabilities are physically. We do provide those resources. One of the biggest things that I'm most proud of is that MS Looks Like Me is we also have a scholarship foundation. And with our scholarship foundation, it is to help the children of patients to be able to continue their education. Because as a parent, I know that that is something that was the first thing that hit my mind. What about my kids?
Wow, I love that. That's fantastic. And, I think there's something to be said about recognizing the financial toxicity that could potentially impact not just you and your family, but, generations later, potentially as well, and it hurts lifetime earnings, not just for you, but also others as well. So I think you raise a really good point, right? So the disease doesn't just impact you, it also impacts your family, other caregivers, et cetera. And so Dallas, why don't you tell me a little bit about your role as a caregiver for Blair, who has MS?
Well, first, being a caregiver is something that I have I don't have any education on, right? So It's just kind of something that's just thrusted up on you at the moment, right? Mm-hmm. And as I sat here and I watched my wife, I was like, look, I have to try to figure this out day by day. And it's not just physical, it's emotional, mental, and then you're trying to figure out the plan for your family as things begin to adjust. And so a lot of times when we become the caregiver, we're trying to figure out what it is, what to do, when to do it, how to do it. And then most of the time, the person who has the illness, they're not trying to accept the fact that they have an illness. So you're not just fighting with yourself, you're fighting with the person that you're caregiving for, right? I think the hardest part at times is stopping them from doing the things and telling them that they need to sit back more than it is to push them to do things. As a caregiver, it can be challenging, but rewarding at the same time.
Yeah, that's so interesting. And, I do recall reading some things here and there about patients versus caregivers and this sort of guilty feeling that patients sometimes can feel by not being able to contribute in ways that they want to contribute. And it's so fascinating to me to hear the opposite side of that. As the caregiver, you don't want her to, right? So that she can take care of herself sometimes.
Yeah, but as I shared with my wife, the greatest help that you're giving me is actually taking care of yourself for the long haul, right? I've shared with people sometimes waking up in the morning, seeing a loved one in pain, but trying to decide whether to be the caregiver or the provider. right? Because you still have to go out there and make the money to be able to bring home, right? But then having the thought process of, is she out there trying to push herself to overdo it in the moment? And the patient never thinks about the stress that that puts on the caregiver while they're out. Because to get a call to say, I can't move or I'm stuck here is probably your worst case scenario.
Yeah, and that's probably something that you have to think about every day, right? Is, you know, when you leave the house, is today one of the days that I should be staying home or otherwise? I know MS waxes and wanes, right? There's better days and there's worse days, and
Yes.
you know, and I know somebody that has MS, and one of the things that struck me was just, you know, the weather can play an impact on your symptoms, and it's just it's amazing to me that something that we all just sort of take for granted. Oh, it's a little chilly today. That might have, you know, an impact on how you're feeling.
Yes.
And whether then, you know, Dallas can go to work, right? Like it's a lot to think about.
Yes.
Yeah.
And I think this is a really good transition. AMCP recently put out a paper that talks a little bit about considering the aspects of these diseases that we can't really quantify, that we can't necessarily put, you know, dollar figures to or study in these clinical studies and whatnot. And, you know, it includes things like considering how a patient is able to form relationships and socialize, and, you know, the mental health considerations, the ability to maintain stable employment. Can you tell me, Blair, what your thoughts are on what you want payers to remember as they make coverage decisions for MS therapies?
I would say be mindful of the unpredictability of the illness. It is completely unpredictable. And just as we just discussed, the weather, that means that the patient in January is not the same patient in July. So what's needed in January is not the same thing that's needed in July. So when we're setting out prerequisites that need to be fulfilled before getting to whatever a physician may have actually planned for that patient, it just may not fit the mold for them at that time. And so there is a need for it to be very fluid for the patients, and understanding that Monday and Tuesday are two totally different days.
Yeah, so it sounds like payers should be thinking about not only individualizing their coverage decisions to the individual patient, but also based on the scenario, whether it's the time of the year that the symptoms aren't showing up or they are showing up more. It doesn't necessarily mean that the disease is not controlled per se on the therapy that it's on. It's just whatever factors are playing into that. Am I understanding that correctly?
Absolutely. Mine is currently under control. However, there's still the up and downs. Rain is a huge factor. Temperature is a huge factor. And stress, whatever the person's going through in their life, the stress being a factor. And also understanding the cognitive issues that come along with it. That's something that is very difficult to measure at times from different aspects. And so that cognitive part, it's life-changing.
Wow. Yeah, that's powerful. And Dallas, I want to ask you the same question. What should payers remember from the caregiver perspective about this as well?
It becomes a challenge, first of all, financially. Within the first 2 years of someone having this autoimmune, 43% of them either lose their job or either have a reduced role on their job. Then within 5 years, you have 56 to 58%, and then within 10 years, that's 75%.
So you're saying that 3 out of 4 of those who are diagnosed with MS after 10 years will not be able to keep their job.
Will not be able to keep their job based off of the statistics. It can become a challenge because you're already playing an accountant because you got to be a budget, you got to be great at a budget. Then you have to be a counselor because you have to get them together there from a mental aspect. Now you're playing the role of nurse today as well. And then you're trying to go out there and try to make things happen as well. And it does become challenging at times from the caregiver's perspective as well.
Wow, that's powerful. Yeah, it sounds like there are quite a few of those intangibles that payers really need to be thinking about when considering that patient and caregiver perspective. Thank you for sharing all that. I want to, while we're on the topic of payers, I want to also ask you, from your perspective, we're on the Unscripted podcast. We're going to call this, what is your unscripted truth about the health insurance sector? What's the one opportunity that insurers have to improve MS care?
As the patient is trying to navigate through the changes that they're going through, and they're now building a relationship with their physicians, we're asked to trust the physician and to follow the physician's instructions, follow their directives, making sure that we're taking care of the whole patient. I would ask that they take that into consideration too in listening to the physician, because sometimes they have their own rules and they don't take into consideration what it is that the physician is guiding the patient toward. As an organization that is to be assisting the patient are now hindering. Now you are causing whatever illness to progress in a manner that was not in the plan. I think about it this way. If the doctor says an apple a day will keep the doctor away, so make sure you have your apple. Okay. And I go to the store and they tell me, well, we're giving you bananas today. We're not giving apples, we're giving bananas. But my doctor said I need an apple. Mm-hmm. Well, bananas are on sale. So we're gonna give you the banana first. Let's see how the banana helps you and see if that can keep the doctor away. Well, bananas have a higher sugar content than apples. And so now I have an insulin spike. So now I'm not here just because of a cold. I'm here now because I have insulin. If I'm going to trust my doctor to go and get the apple, can I get the apple?
Yeah, absolutely. And I love your analogy. It's not that you're being asked to take a Red Delicious instead of a Granny Smith, right?
Right.
It's a banana instead of an apple. Yeah, that certainly would be concerning from the patient perspective, and something that the payer should continually recognize. I know that it's always on our minds, is not getting in the way, but, such a challenge to institute policy at a population level and then also recognize, the individual scenarios where those exceptions need to be made. And that's an excellent point that those situations will come up, and payers just need to continually recognize that.
Absolutely. Whether it's a medication, whether it's a procedure, whether it's a test, it doesn't matter what it is. If that's what's needed, and we're trying to build that trust with the physician, because when we can't get those things, it's not exactly helping build the patient and physician relationship.
Absolutely. Fantastic. Well, thank you for that. And I also want to end this on kind of a positive note if we can. What is one silver lining that's come from this experience?
So much has actually come out of it. But the greatest thing is MS Looks Like Me, to be able to be a voice and be able to help others be a voice for themselves. While I want to advocate for myself, I want to advocate for others, I want to also encourage others to advocate for themselves and to join community. You are not fighting this alone. We are in this together. Whether you're an MS warrior or a lupus warrior, a Graves' disease warrior, it doesn't matter. If you are battling something, there are others that are battling the same thing. And while I know that multiple sclerosis is a chronic illness that is, just so fluctuating, we're in this together. And the best thing that you can have is an advocate by your side to help walk through it. And if you don't have one, there are plenty out there that would definitely take you on and will help walk the journey with you. And us at MS Looks Like Me, we will definitely do that.
I love it. And your ability to find the positive, the silver lining in this situation is so inspiring. And thank you so much for taking the time to speak with me today.
Thank you.
Thank you to our audience for listening, and we'll see you next time on the Unscripted podcast.